Hello and welcome to another brand new episode of what was formerly the Empower M1 MEN1 podcast, now changing names to the MEN1 Mosaic Voices of Empowerment. My first guest under our new name is Neil, and he's very kindly come and agreed to, he's waving at me now, which you can't see, and you'll be able to see him in a minute, but he's agreed to come on and share his journey so far with MEN1, which I think is really fascinating. There are a couple of things about Neil's experience, his story, which make him quite different in terms of an MEN1 patient, and also his background is very interesting, and he might well be able to offer some insights which we might not normally get from elsewhere. So welcome, Neil. It's really cool to have you on, and thank you for agreeing to be here.
Hello. Hello, everyone.
It's really great to have you on, and I've certainly enjoyed the chats that we've had so far. And I'm going to jump straight in with my first question, which I ask all my patient guests. What is your journey so far with MEN1? Where has it brought you to? And yeah, how are you doing at the moment?
Right. So my journey with MEN1. So I started off going into hospital at the age of 7. So that was in 1980. And I went in and out of hospital for various different things, mainly for kidney stones, and later on to do with lipomas and that sort of thing. And then when I was 16 years old, so that would have been 1989, that sort of thing. One of the doctors wanted me to stop my GCSEs and do exploratory throat surgery, to which I said no, because that scared me that I wouldn't be able to do my GCSEs. And it wasn't until 1997, with my upteenth kidney stone, did they register that I had parathyroid problems. So this was the first sort of known link with MEN1. They successfully took one out on my left side, I think, and then all well and good. It wasn't until I was 46 years old was I diagnosed with MEN1. The reason being is that as a gene, as a hereditary type thing, I'm adopted, so there was no way of gauging whether there was history of it in my family. So this is where we'll come from. So that's my sort of journey. During that time, I've had about 14 operations for kidney stones and lipomas and so forth. I only come to light when I had second parathyroid surgery. Did urologist at the time say, "Oh, this could be something a bit more than just kidney stones and that sort of thing." And so they sent me off to genetics, and I was diagnosed with MEN1. To which actually I cheered when I heard that, because there was something that they'd put something together and said, this is why you're going in and out of hospital. So I cheered so much. If the camera's on me, then this is what I've done. I stamped myself with MEN1 just so I could sort of take ownership of that thing. And yes, I mean, this was before obviously I knew about the groups that we're in and stuff. So, it was quite a lonely, thing going all the way through up to that. So I'm glad there are other people out there in a way, and I'm also not glad because I'd rather them, not be ill. But yeah, so that's my sort of background towards it.
It's certainly a fascinating one, and particularly because of your obviously being adopted, and then it takes out an element of, I don't know if I can call it certainty, but it's very different to my journey, which was, my father had it, his late sister had it, their mum had it, and so there
Yeah,
was an element of, I hate using this word, but control. Like, my parents knew that at some point they were going to have to get their kids tested. You didn't have
yeah,
any of that. You didn't have
no,
any of that, and it took so long for you between your first symptom and then your diagnosis, which just seems bonkers nowadays. And
Yeah.
do you feel like that, not so much the gap between the diagnosis and the initial symptoms, but more the lack of a family history? Do you think that has at all put you at a disadvantage in managing this condition?
Um, well, I don't know, you see, because that's, yeah, well, I think it would have been better earlier on, when I was younger, perhaps. But then again, you're older and wiser, aren't you now, as you get older, and perhaps wouldn't have been able to um, understand so much when I was younger about the disease as much as what I would now. Because you end up sort of doing your own research, don't you, into it, and I might not have done that, but I might. But then again, it could have changed my entire outlook on life there and then. My first lipoma, proper lipoma, was a lump in my stomach, the size of my fist. And at the time, I was working for a pharmaceutical company, and I had private healthcare. So I was straight on to go at that. And the consultant there was like, we think it's a lipoma, and, described it to me as a fatty lump, blah, blah, but we can't rule out cancer. So they said, we'll have you in and take it out because it's ghastly. That's what he was saying in his own words. It looks ghastly, doesn't it? Let's take it out. So I go, yes, please. So I distinctly remember him saying that he wouldn't be able to do it in the first 2 weeks. I've just visited him. And as you know, with the NHS, there are waiting times because he was playing golf. So he was up front with us. So, but in 2 weeks, I was had my operation and had the lump taken out, and then they sent it away for biopsy analysis, and it come back that it was benign, so that's a problem. And I remember the consultant then saying to me, if it was cancer, here's the operation I had prepared to take half of your stomach away and that sort of thing. And but in the nicest possible way, Mr. Stanford, I wouldn't want to see you again. His sort of thing. So, and I left the hospital, and my work was only not so far around the corner from where that hospital was. So they were going to say to me, get a taxi on account and that sort of thing. But I said to them, no, I want to walk back because I wanted to, just let that news sink in, that sort of thing. So at that time, I did not know I had MEN1. This was the year 2000 something. So, yeah. So if I'd have known I had MEN1 before then, and that sort of thing come up, it may have been easier to grasp, that sort of thing. We can say, well, this is a variant, that some people get lipomas and that sort of thing, rather than just being a straight off, this could be something else, entirely. So looking back, maybe it would have been better to have known, beforehand, rather than waiting. But it's done now, so at least I do know. And it's like, yeah.
I agree. And I think hindsight is one of those funny things because it's so easy to look back and say, oh, I would have done it like this, or I should have done it like this had I known. But ultimately, we didn't know at the time. And all we are ever doing as human beings is the best that we can with the knowledge and the information that we have. And ultimately,
Yeah.
that gets us to where we are. So it's a very interesting question when I ask it. And I feel like it's in some ways loaded because, it's very difficult to know what you would have done if you'd had different information. But I think it's a very thoughtful response that you've given it, and particularly in terms of perhaps informing the way that you might approach your healthcare now. Given the way that things have turned out. So it's
Well, I mean,
an interesting one.
yeah. So with that, I'm a lot more wary about my healthcare and stuff since I've been diagnosed than I was then. You know, when I was younger, fast and loose, and I don't remember much of the 1990s because I partied through that decade basically. So I would perhaps have reined it in quite considerably if I'd have known that there was, you know, I'd have had, put your pancreas under so much strain and your kidneys and that sort of thing, you know. So it may well have changed my outlook if I was diagnosed. But I mean, I heard something from somewhere though that diagnosis for MEN1 was quite rare during the 80s and coming into the 90s. So it may have been still quite hard for anyone, to have put two and two together in the first place, which they didn't do for ages anyway. But yeah.
Absolutely. And there's a lot of unknown variables. And we, as patients, I guess part of the journey is also understanding that we're not going to have control of pretty much everything.
Yeah. Yeah.
And we are very much relying on the support of external sources, which varies in degree in terms of reliability and consistency. So I think it's a really valid point that you've mentioned. And actually, over the past 5 minutes, you've mentioned so many different things, which I want to come back to.
Yeah.
You talked about your experience in the pharmaceutical kind of industry.
Yeah.
And when we chatted before, you mentioned that you'd listened to my podcast episode I'd done with Cass, who works with
Yeah.
leadership teams in that industry. And I wondered, what do you think that knowledge or that experience has given you that another patient might not have, perhaps when it comes to looking at the use of pharmaceuticals or big pharma or anything like that?
Yeah, so it's an interesting one because depending where you are in the world, isn't it? It's a different thing here. The NHS works on bulk buying things, and looks under everything through NICE. Whereas, as we know, and people who may be viewing this from the United States, is a completely different system. And I think their big pharma works a bit different over there because of the way they have to use insurance and that sort of thing in healthcare. So that money and cost of things impacts them, I think, a lot more than it does for us who live in the UK or maybe in Europe. And I was just pleased that someone could set out how pharmaceuticals, once they have gone through their 3 stages of development and that sort of thing, and into the 4th stage, and getting them recognised by the various governments and that sort of thing. How far it does and what money is put into it in order for it to get through to a stage where we take them. Because there's quite, you see it all the time online where people, especially when it comes to vaccines, that quite a lot of people have no knowledge of that, of what it entails to get something to market, and different to vaccines though, because, some pharmaceutical companies will concentrate on different areas of things that they'll try and put drugs through. So quite a lot of them will concentrate on cancers and that sort of thing, rather than just specific diseases like we have, because there's such a smaller amount of us, and that they sometimes won't put the money into, because it doesn't affect such a large section of the population. And they are, by and large, they are private companies, so they will be profit driven in some sort of respects. They're not, they're not charities, but the people the scientists who work these things out are generally good people, and they do want to help people. That's why they went into that, as well as being interested in in those sort of things. I've got to stick up for my scientist colleagues. So yeah. But that was a good talk because it was easy explained that sort of journey that they go on, drugs go on, that could help us. That's yeah.
I'm glad you said that, and I chuckled when you said, "Oh, I need to stick up for my scientist colleagues," and I think that's a really valid point because it's such a heavily demonized industry, and it does make the headlines, and not. I mean, I'm not going to say necessarily for all the right or all the wrong reasons, but it's so misunderstood, and I think that's what you've put your finger on so well, and perhaps why the episode rang bells for you, why it's actually done quite well, it's been quite popular, is because it does lay out very simply something which is ultimately so complex and very, very easy to misunderstand.
Yeah.
And on a very similar note, because you mentioned about the differences between the US and the UK, and there's one very big difference in medicine, another very big difference in medicine between the US and the UK, and that's private healthcare and publicly funded healthcare. Again, the systems are so different because in US there's that's what I'm looking for. Oh, insurance, and the whole thing is done so differently. Over here, it's something we are very much taken care of by the NHS as MEN1 patients. I talk about it a lot. I say how fortunate that a condition which the NHS calculator tells me I could end up paying up to 50 grand a year for it. I'm not having to fork out. I'm not having to pay that out of my own pocket, which is amazing. But you and I chatted very recently, and we discussed that actually the complexity of it is that not everything in MEN1 can be covered because there are so many little intricate details which need to be looked at and discussed. And you mentioned about your the situation with your lipomas, and I just wondered how are you navigating that? If you're talking to someone who has no idea that there might need to be a kind of private medicine element in MEN1, how would you explain how you're sort of navigating that, and what there is to factor in and take into account?
Well, I mean, I'm not on private healthcare anymore because I moved to work for the University of Cambridge, which as is a public funded body, obviously. So we do get some benefits for having reduced private healthcare sort of thing. So but yeah, the navigation between because I've seen both sides. I've been in hospital numerous times through the NHS and through private healthcare, and I mean, I don't begrudge anybody. People would say queue jump, and that sort of thing, because that leaves a space open for someone else on NHS. Yeah, so with lipomas, they are usually considered as cosmetic surgery because they're usually skin type problems, fatty lumps to do with the skin. Sometimes you can, depending on where they're situated, you may be able to get them on the NHS. I have certainly before in some areas, and that which curtail your quality of life by movement, mainly, and that sort of thing. But other than that, it's a question of paying to have them taken out by going private, that sort of thing. Now, the problem is, mine would be one-off type private. I'd seek out one-off private things, have these taken out. I can't get adequate health insurance as such because now I've got a known condition. So, as you know, if you've got a known condition, your premiums skyrocket. So it's cheaper to go to Nuffield or Bupa or whoever. I'm not going to single out anyone particular, and go to them and say, I have these problems. Will you be able to take them out? How much is that going to cost? But first of all, I would see my NHS consultants, because they could be the same people. We never know. Um, and see what is doable. That's the first thing. Or research is what is doable. It's all right coming, waving a wad of cash around and saying, "Oh, can you take these out for me?" It's, you know, you need to know what is doable, what they can take out, what they can't. So you know where you lie in that sort of paradigm. Yeah.
Absolutely. And yeah, it's interesting you mentioned there the point about you might end up seeing exactly the same consultant, you know, having exactly the same treatment, and one of them you're going to fork out and one of them you're not. But it's sometimes more complicated than just, you know, either either or, you know, either one or the other. It's,
Yeah.
you know, a case of weighing up, as you say, and all the kind of contributing factors. And that's the sort of thing which you don't know until you get there. So I think it's a really valuable
Mm.
piece of conversation to have, because I wrote about it recently and I had a couple of people get back and say, actually, no one really talks about this. No one else really brings this into the foreground. So I'm really glad we've had this, and I hope that anyone who's listening back, you know, who might have needed to hear this conversation can glean from what you've said, something that
Mm.
might help them either make a decision or know the next step to take. So thank you for delivering that part of our conversation. I'm grateful for that. I am conscious of the time, and I always feel like I get to this part of the, you know, this stage of the episode and think I wish I could talk to this person all day, and that's definitely how I feel right now. But sort of beginning, I guess, to wind up, I wanted to come back to your tattoo.
Yes.
And you stamped it, or you said, you know, you got stamped, and
Yeah.
when you did this, you said, "Oh, I wanted to take ownership of MEN1," and those words have been sitting with me ever since you said them. Can you explain what do you mean by take ownership of MEN1?
Well, because beforehand, because I didn't know what, you know, I was suffering. That's, it seems like such a horrible word. But since I didn't know that my journey of MEN1 was MEN1 to such a point, this relentless going in and out of hospital. I'm so relentless. It wasn't like every day, obviously, but this sort of thing of going, you know, going in for having, you know, a kidney stone operation, you know, well, yeah, my first kidney stone, I was 14. I was in class. I've collapsed to the floor in pain. You know, I was a kid, sort of, and going through those type of things and all different things. And you keep thinking, why me? Why am I suffering from this? Why am I suffering from this? Completely different thing. Why am I suffering from this? Most people just get colds, you know, or they go to hospital because they've broken an arm in an accident or something like that. And I'm continue going in and out. So when I was diagnosed, I had something there, and I was told it was rare, and I didn't know anybody else. You know, I didn't know anyone else who had that. So I thought, you know, that's quite unique in a way. So we have to live with this. You know, we can't get rid of it. So why don't we? I use it as a banner to sort of say, well, this is part of who I am. You know, so people get, you know, I've got countless other tattoos to be honest with you, but they all mean something different. This one, I was just thinking, you know, this is part of me, so I will take ownership of it and not be scared of it. You know, so in that case, you know, so that's why I got it done to stamp of approval. So,
I love that. I really love that.
it,
And what a kind of
it
beautiful message.
it also helps because it's on my wrist. You know, I had a dearly departed friend who lost her life. She talking about endocrine type thing. She was diagnosed with Addison's. So you know, that's another rare sort of disease. And so I used to take her up to endocrine anyway to her. So I know endocrine before I even arrived there and that. And they used to have like little bracelet things they'd give to them. So that if they were in anything like adrenal crisis or something like that, and an ambulance come for them, that they would understand what they were dealing with. And I thought, well, we haven't got anything like that, have we? Well, I didn't know at the time. So that's why I got that as well. Might try to give some sort of meaning. maybe someone paramedic could be able to spot that and see, whether that would be helpful or not. I don't know. There was a dual thing there.
I absolutely love that. Yeah, it's a great alternative to a medical bracelet, actually. Just having
Yeah,
having that clear as day.
yeah,
No having to
yeah,
faff around to find it. No, I
yeah.
think that's great. And I love what you said about the taking ownership, because I talk a lot in my content and on my page around this idea of can can I turn, well, my experience has been, can I turn my biggest challenge um into my greatest quality? And in
Mm,
order to do that, in order for anyone to do that, I guess one has to, um instead of fighting, MEN1, start to accept it and kind of see what it is that it brings, and lean into that difficulty, lean into the
mm,
challenge, lean into all of that. Um, and it's quite clear from the way that you talk about it and talk about your experience that you've come through a journey, and with that you've taken on so much, so many learnings, so much to reflect on. I mean, this conversation just in 20-25 minutes has been full of that. So I think it's a kind of really valuable thing to be closing on. And I love the tattoo. I mean, that's the first MEN1 related tattoo or piece of body art that I've
mm.
seen. So that is a that's something to remember in and of itself.
Yeah.
I'm so sad to be having to draw to our final question, and
Yeah.
I'm grateful in a way, because I think we've set this up, or we have been set up perfectly for it. If you were to give a piece of advice either to a past version of yourself or someone who is having to navigate the challenges of MEN1 right now and may not have your years of experience, what would that piece of advice be?
But my piece of advice would be to challenge exactly what your medical people are telling you. Um, yeah, especially if it's a parathyroid, or if it's like, because usually it's because you have a second parathyroid. It may be better to jump the gun a bit and say, what could this signify? Not just, having my parathyroid taken out, because that happens to lots of people. Um, yeah, because when I had my parathyroid taken out and a kidney stone, it happened. Kidney stones happened again and again, and people um, didn't suss, nor did I suss that was going to lead to the same, going to lead to that diagnosis and having other parathyroids out. So I think with anything, it is, if there is a standalone thing, should look at whether what other things could be a deeper thing. Don't scare yourself with them. Just say what other alternatives could be, rather than just this. First of all, are there other symptoms I look out for that are related? And if they are, and then ask again. Ask whether you should be checked again. All that.
I love that, and very, very important with a condition like this, really, which is, as you've experienced, not always the easiest to diagnose and can be
Mm.
misdiagnosed. And even with the diagnosis, sometimes things get dismissed or missed or looked over or whatever. So a really, really valuable
Yeah.
piece of advice. And I'm sure, as I say, anyone who's listening will be either agreeing with you, or if they haven't heard it before, very grateful in terms of their journey to come. Thank you, Neil, so much for your time, for
No
your
problem.
wisdom. It has been such a pleasure to have you on. You feel like I feel like I'm talking to a sage of MEN1. You have a real calmness, a collectiveness when you speak about your journey, which I can just tell will have had its highs and lows. But I think for so many people watching this who might be right down in the pits of the pits at the moment, they can, take inspiration from where you are now.
Mm.
Or people who maybe are, at the peak, or they're very stable or whatever, can find some sort of you know, relativity in terms of your positivity and your pragmatism towards this condition. So I
Mm.
can't really thank you enough for that. And you are around, which is amazing. And it's definitely, I'm glad that you are coming in, as the podcast name is changing, to Voices of Empowerment. Yours certainly is one of those. So I can't thank you enough. And all the
Excellent.
best with your health journey. And let's keep in
Yeah,
touch.
you too. Yes. Thank you.